One of the more unusual mental disorders used by some defense attorneys in cases that involve murder or attempted murder is what is called folie à deux, or madness of two. Some famous examples of folie à deux include the case of the 41-year-old Swedish twins Ursula and Sabina Eriksson that led to chaos and murder, the case of the 15-year-old New Zealand girls, Pauline Parker and Juliet Hume, which involved matricide. The movie Heavenly Creatures with Melanie Lynskey and Kate Winslet was based on that one. And the case of Morgan Geyser and Anissa Weier, also referred to as the Slenderman case. Here I will explain the disorder, and in subsequent parts I will flesh out these famous examples. Folie à deux is a striking phenomenon in the world of psychology, but is still poorly understood. It is also sometimes referred to as shared psychotic disorder, and it's a concept that examines the way that delusions can manifest. It is no longer included as a diagnosis in the DSM. Folie à deux typically involves two individuals, but sometimes more, who share a particular delusion that comes with a significant risk of criminality, usually murder or attempted murder. And the homicides involved are particularly brutal in nature. The two most common types of folie à deux are persecutory or mystical. In folie à deux, the two affected persons are usually long-time, intimately linked individuals. In the duo, there is a primary partner, also called the inducer, the principal, or the dominant partner, and a secondary partner, also called the associate or the submissive partner. Most primary partners have some form of schizophrenia or delusional psychosis, often paranoid or persecutory. And the submissive partner adopts the delusional ideas and is the one diagnosed with folie à deux. Three main theories explore how folie à deux emerges within people. The first is referred to as imposed psychosis, and this is where the primary person is psychotic and they transmit the delusions onto the secondary person who did not have a history at all of any mental disorders prior to the relationship. When the two are separated, the delusions persist in the primary partner and resolve in the secondary partner. Communicated psychosis is the second theory, and it is like imposed psychosis, except for the fact that the secondary person adds delusions to what the primary person originally introduced, and when the two are separated, they both remain psychotic. The third is called simultaneous psychosis, and this is where delusions appear simultaneously within both individuals. So they are two people who have delusions and then find one another, rather than a shared delusional energy due to the connection. The vast majority of folie à deux cases occur within the same family, and 1/3 of the cases involve siblings. And never before have I seen a stranger case than the one involving the Swedish twins Ursula and Sabina Eriksson, which we'll explore more deeply in part 2.